Are you a man or woman in a serious relationship that might lead to marriage or pregnancy? Then these are important tests you need to run before you commit yourself. These tests are important to avoid you having regrets in future. These tests are important to avoid having children that will bring into the world to come and suffer. Hi, welcome to Health and Wellness with Dr. Happiness. I am Dr. Happiness, your trusted guide in family health and wellness. In this episode, we are going to talk about medical tests that are very important for you to do before you commit yourself into long-term relationship or into marriage. These tests are very necessary and they are very simple tests to run. They don't cost much, but it will save you a lifetime of trauma and regrets. If this sounds like what you are interested in, then sit back and let's dive in. The first and most important test to me as a mother and as a medical doctor is the genotype test. The genotype test helps you know what type of genotype you have. If you're genotype AA, AS, SS, or SC. There are various other types of genotypes, but these four are the commonest. Knowing your genotype helps you avoid bringing up into this world a child that has sickle cell anemia. Sickle cell anemia is a genetic disease that affects children born with genotype SS. It is very debilitating in children that have that genotype, the genotype SS. In fact, the trauma having a child with sickle cell anemia can be very devastating on both the parents and the children. It saps the parents' pockets. There's a lot of emotional trauma involved that you will pray not to have a child having a sickle cell anemia. Because in times of crisis, love is not enough. If you happen to be genotype AA, then you don't have any problem. You can marry anybody regardless of the genotype. But if you happen to be genotype AS, SS, or SC, then you should marry somebody with genotype AA. That way, you avoid having a child with genotype SS. If you're genotype AS and you marry somebody with AS, you have a 25% chance of having a child with sickle cell anemia. If you're genotype SS and you marry somebody with genotype AS, you have a 50% chance of having a child with AS and SS. If you have genotype SC, I will advise you, please look for a partner that has AA genotype. That way, we'll stop bringing into this world children that will come and suffer for no fault of theirs. Let's make the wise choice. Let's do our genotypes today and then live a happier married life in future. This simple decision you take today will save you a lifetime of trauma, sorrow, and regret. There are incidences of fathers abandoning their wives and children with sickle cell anemia in the hospitals just because they can no longer stand the emotional trauma and even the financial trauma. When you have a child having crisis, you regret ever making the mistake. So do the right thing. Do your genotype test and that of your partner without delay. I will advise you do the test in 2 or 3 labs, different labs, so that you can compare the results. Because sometimes, due to machine error, human error, error from the reagents, you could get results that are incorrect. But having 2 similar results or 3 similar results guarantees that the result you're having is the correct one, because you cannot afford to have a wrong genotype. The next is blood group. Having a blood group that is compatible with your partner is very important. If you are a woman that is rhesus negative, we have 4 and sometimes people say 8 different blood types. Your blood group can be blood group A, B, AB, or O. And then if you factor in the rhesus factor, it could be blood group A positive or negative, B positive or negative, AB positive or negative, O positive or negative. You either have rhesus positive or you don't have. It is not something you can walk around. Where it's important is where you are a woman and your blood group has no rhesus factor, meaning your blood group is rhesus negative. And then you marry a partner that has a rhesus factor on the blood, which is rhesus positive. In that case, when you're pregnant, you need to take an injection that will help protect your baby. If you're pregnant and you are injured, you also need to take that injection. The injection is important because when your baby is being delivered, you know there's a communication between the baby's blood and that of the mother during delivery or even cesarean section. And so the baby's blood will go and sensitize your blood, supposing that baby is rhesus positive. And so your body forms antibodies like soldiers ready to fight such type of blood type when next you get pregnant. If you've ever had a miscarriage or an abortion or injury while pregnant and you're rhesus negative and your husband is rhesus positive, you need to take that injection. This will help protect your future babies. Having rhesus incompatibility can predispose your unborn babies to rhesus isoimmunization. Your babies can have injuries in their brain, you can miscarry, and other complications resulting from that rhesus incompatibility. Having rhesus incompatibility with your partner should not stop you from getting married. It just keeps you aware of what you're to do in the event that you're pregnant. If your partner happens to be rhesus negative and you're rhesus negative, you don't need to do anything because there will be no sensitization. So go to the lab today, run your blood group test. When you do the blood group test, you will get to know your rhesus factor at the same time. It is a simple test. It's teaching time saves 9. The next test is knowing your HIV status, your hepatitis B and C status, and other sexually transmitted infections like gonorrhea, chlamydia, syphilis, herpes. Knowing your status for these infections helps both of you to know how you're to handle each other. Like if you are a female and you're HIV positive and your partner is HIV negative, you can now discuss it with your doctor. It doesn't stop you from getting pregnant, but it will help you to make informed decisions on the way forward. It also helps in being open in your relationship. It helps in building trust in your relationship. It helps in helping you know how to protect yourself for your health and the future of your marriage. Knowing the mental health status of your partner is also important in these days and age where there's a lot of domestic violence and a lot of divorce. Mental health status of your partner plays an important role in how you handle differences. Mental health is everything. It affects how you love. It affects how you relate with each other. It affects how you argue. It affects how you solve problems, financial, emotional, material, etc. It affects how you handle stress. It affects how you recover from stress. So go for a simple mental health evaluation test today. It will help you to understand your partner better. Some other people might want to do fertility checks to know how fertile they are. It's good to know. Do these simple tests. Doing these tests will save you a lifetime of trauma, sorrow, weeping, and regret. Doing these simple tests will help your marriage in future. It will help you bring children that are healthy and happy. When should you do these tests? Genotype tests should be done early in your relationship, when the bond has not become very strong, because it is not easy to, after doing the test, when it's late, to say, oh, I can't go further. The emotions have already built up. I advise you to do your genotype test early in your relationship if you're going to take that relationship further. The blood group, you can do it before marriage, you can do it during pregnancy. The same thing with the other tests. For mental health check, it is better done before marriage so that you don't get committed and you will now find it difficult to withdraw. If you have found value in this video, click the like button, subscribe, share it with your friends, share it with your families, share it with your loved ones so that they can be better informed. And together, let's build healthier and happier families. See you in my next video.